Runny nose and nonstop sneezing? The right remedy depends on the pattern. Itchy nose, watery eyes, and flare-ups around pollen, pets, or dust point toward allergies. Saline spray can rinse away irritants. An antihistamine may calm sneezing and itching. A steroid nasal spray can help persistent symptoms, but it works best with consistent use. Sore throat, cough, fatigue, aches, or fever point more toward a virus. Rest, fluids, saline, and a clean humidifier can ease symptoms. Antibiotics do not treat a cold. One warning, fast-acting sprays containing oxymetazoline or phenylephrine can cause rebound congestion if used longer than 3 days. Saline and steroid allergy sprays are different. Seek prompt medical care for trouble breathing or dehydration. Get checked if fever lasts over 4 days or symptoms pass 10 days without improving. Not sure which pattern fits? 20 Mile Medical offers non-emergency online care by chat, phone, or video. Visits start at $45. Link in bio.